Good morning, I'm Francesco Cicognani, project manager of CHEMOMAKER. CHEMOMAKER is an innovative technology for the compounding for patent-specific chemotherapeutic drugs. Is able to overcome most of the critical elements connected to manual preparation of chemotherapeutic drugs. Is the main characteristics that improve CHEMOMAKER is safety, traceability, sterility, accuracy that are very important in the preparation of chemotherapeutic drugs. The machine is a tabletop machine. It can do 12 preparation at automated preparation at a time, and have a lower rotor that fill 16 chemotherapy drugs. And this is the main characteristic. Safety, because the drug does it directly into the final container intended for administration. It can administrate bags, syringes, elastomeric pumps, and it's avoid any subsequent manipulation and preventing contamination for healthcare professionals and patients. Another characteristic is traceability, that the CHEMOMAKER allows the operator to organize the preparation activity according to the prescription received from the oncology department, and all materials are identified by barcode and RFID that ensure multiple automatic checks, assure high accuracy and safety of the final product. The sterility, because the system is based on a robotic unit and fully automatized the dosing process, and it's based on a closed system based on disposable sterile cartridge that prevents the contamination of the environment by the toxic drugs. Another feature is the accuracy, because the CHEMOMAKER have built-in a gravimetric cell that control in real time the dosage of the formulation, and the accuracy is up to 1%, more than 1 order of magnitude higher than the precision allowed by European Pharmacopoeia in the manual preparation of antiblastic drugs. It's a tabletop machine, and it is a compact system that can be easily placed in the existing class 2 laminar flow hood present in the pharmaceutical laboratory to prepare the antiblastic drugs, and does not require dedicated space or installation works. This is an accessory supply with the CHEMOMAKER. This is a final container holder that contains bags, syringes, elastomeric pumps, or EcoFlux. The laser and radio frequency Bluetooth reader is used under the laminar flow hood to identify for the loading and unloading the component on the CHEMOMAKER. This is an example of disposable cartridge. This disposable cartridge is in 2 dimensions of 20 milliliter, 30 milliliter, and can take up to vial up to 100 milliliters. On the right there are connectors. The connectors are used for the dosage directly into the final container. And the cap is used for storage, because you can store the residue on the vial directly in the cartridge until the expiration date, in according with the expiration date of the open vial of the drugs. This is an example of the assembly of the vial and the various final containers. CHEMOMAKER is supplied with a software. The software is called ChemoPlan. It is supplied with the computer, with a PC and all accessories. The software manages the prescription and the work cycle on the machine. It can be interfaced with the main prescription software in the hospital with HL7 protocol that can that can ensure to communicate from the CHEMOMAKER software to the oncology department and pharmacy software in the hospital. The system generates a final preparation label that it can modify in according of the need of the hospital. It have a drug database that is fully customizable with all the data supplied by the pharmaceutical company of the drugs, and the software allows an automatic optimization of the use of the drugs to reduce waste of the using of very expensive chemotherapy drugs. This is a table of the advantages compared to manual preparation of CHEMOMAKER. There's a sterility because the system is based on closed circuit and guarantees sterility of the preparation. Velocity because it's faster than the manual preparation, as it can do about 25 to 30 doses per hour. Ensure operator safety because have a less exposure to toxic agents, reduction of needle injuries in the manual preparation, and reduction of hand fatigue pathologies it can present during the year, very much year of preparation. The dosing accuracy is up to 1% thanks to real-time gravimetric control system. There are advantages in time per person because less time is spent by operators who don't need to monitor all the stage of the process because the automatic control of CHEMOMAKER ensure integrated in the machine ensure all the control in the preparation of the antiblastic drugs. Patent safety because there are a virtual elimination of error related to manual drug preparation. There are accidental drugs or patent exchange or incorrect dosage. There are improving waste and cost reduction into a reduction of partially used drug waste to consent to optimize the cost of the drugs. And the chemical continuation because the closed circuit avoids the contamination of the surrounding environment and sure. There are next upgrade of this machine coming soon. There are another connector that do the second inlet of the bag and allows the use of pre-filled infusion sets that are very important to give at the patients with safety the drugs when go to the patient directly. In the Q1 of 2022, there are 3 new features in the CHEMOMAKER. There are power drug reconstitution system because CHEMOMAKER only work with liquid phase drugs and not allow the reconstitution. But you can reconstitute in manual and connect to the cartridge. But in the Q1 2022, we have a machine to power drug reconstitution directly on the cartridge. A new support with an accessory for the use of multi-dose bag up to 100 milliliter for 1000 milliliter for the preparation, and an automatic filling system for elastomeric pumps. There are filled manually, and then there are the dosage of the drugs. Thank you, everyone.